first question definitely for you is going to be kind of out of all the healthcare profession, why did you choose physical therapy as kind of like where you wanted to go?
Yeah, so I got almost like forced into it, quote unquote. So I volunteered at like my athletic trainer's office in high school, just get some shadowing hours, and basically she was like, you probably don't want to be an athletic trainer. Hours suck, pay's not great. Like you should look into physical therapy. And I was being recruited for soccer at the time, and I think I had said something about athletic training to one of the coaches, and he was like, "Oh, well, we do have this PT path with Thomas Jefferson, which is where I went to PT school. So they had like a 3-3 degree, and they were like, you should apply to that. Like you have good grades." And so I applied, liked the conversation. That was good. I got accepted to that through 3 or 4 of the schools that were recruiting me. Ultimately went to St. Joe's and did that 3-3 path. And I was like, oh, maybe I'll be a professional soccer player. Maybe I'll, get good grades and decide to go to med school. But I had to go through some physical therapy myself and shadowed a bunch of good PTs and enjoyed it. So, I kind of got into it. That stereotypical story of like, you're the athlete, you get injured, then you want to help people not get injured. So like, it's not a super original story. But yeah, it ended up working out really well. I did not have the background that I should have going in. I've told this on like other podcasts before, but like I walked into day one of class and our teacher started talking about like being in a hospital and you have to manage patients' lines and IVs and stuff like that. And I was like looking around and I was like, this is like PT, right? Like I'm here for like the muscles and the exercises and like the hands and like I'm gonna get magic hands. Like I don't go to hospitals, so like I didn't even really know what I was getting into, but it worked out fortunately. So
I gotcha. Did you ever work in a hospital or did you just only have clinical rotations in a like hospital setting?
so since we were like tied to the hospital at school, we would get to go over and do shadowing pretty frequently. Like I got to see some pretty cool stuff in the hospital, and then I did one 10-week rotation on like a cardiovascular general medicine floor. I never had like a full-time job in an acute care setting, but I did do my 10 weeks there, which was enjoyable. I like really liked the collaboration aspect of it. Like you got to talk to doctors on the fly, nurses on the fly, like that, with that team oriented environment I really enjoyed. I was like applying to acute care jobs when I got out of school, but just ended up going more the orthopedic route, which I think has um, you know fit me well, but I did really enjoy my time doing those rotations.
Okay. So would you say like in the hospital, the communication between doctors and physical therapists is actually a little bit better than kind of what you see in your typical outpatient, or is it really just kind of depend on the environment and where you're at?
I think it depends on environment and where you're at. There are like some physician owned clinics where like my first job actually was, it ended up being in workers' compensation, and it was owned by the physicians and they were just like right next door. So we would get to walk over and ask them questions all the time. And that was super collaborative. Um, in the hospital, sometimes that was great. Some doctors wanted you to talk to them, some didn't. So I think it just depends on environment, but it's definitely more like, you know, more streamlined in the hospital ideally than it is, if now I'm in a standalone facility, if I have to get hold of a doctor, I have to call their office, so on and so forth. So um, it just kind of depends.
I gotcha. And so are you like an outpatient and still working with insurance, or are you kind of cash based right now? Because I know a lot of people and there's a lot of the cash based that are popping up.
Yeah, so we are out of network with insurance. So we like, I don't love the phrase cash based because it makes it seem like someone has to bring like a paper bag of dollar bills to pay me. Like I can accept their credit card, so and their FSA card. But yeah, we're out of network with insurance. I've worked in insurance based settings before. Like I've been out on my own now for 4 years. But prior to that, worked in insurance based settings. I think it just depends on how you structure it. I don't think one's necessarily better than the other, but currently we don't take insurance. All our appointments are hour to an hour and a half. We do a lot of like hybrid treatments where people will come in, see us, and then we give them a lot of stuff to do on their own. And we'll be checking in with them in between appointments. They're texting us, sending videos for feedback. So we purposefully, we can't bill insurance for that. So we just have to not use insurance and charge a little bit more so we can provide that like what we think is a higher quality service.
Do you think it like working outside of insurance companies kind of gives you a little more freedom to really do, I would say, I wouldn't say more beneficial work, but allows you to kind of be unique and creative without having to worry about billing and how you like write stuff up? Does it give you more freedom and stuff like that? You think?
Yeah, I mean, 100%. Like, I just go into every single appointment just knowing that I'm going to do the best that I can for the person on that day. And like, I'm always reevaluating, reassessing what's working, what's not working. Like if I had to attach codes to that, or if I had to be managing like time, or, worried about how am I going to document this so somebody pays me, like that would just be such a headache that I never really worried about that when I was in like the um, insurance based settings I was in, but that would get me in trouble with my supervisors because they'd be like, oh, you haven't billed for this code, or you haven't done this, or you spent too long with this patient. Like I just always tried to do the best I could, but I wasn't being paid directly by the insurance companies in those settings. Like I was getting my hourly rate. So me as a business owner now, like I just want to do what's best for people. So it's great to not have to worry about that essentially.
Yeah, because I noticed one thing because I spent a good amount of time at a outpatient while I was getting my undergraduate, which was very nice, and that I got that experience. And it's just I think what a lot of people don't understand is like how limited care you can get with insurance. Like, could you really speak on like how? Because I know insurance will sometimes limit people's visits, or like, oh, we're only going to give you so much. You got to show that they're improving because no matter what, the insurance kind of can cut them off. Could you really explain that, and kind of expand on that, so people might listen and could understand, be like, oh, I didn't know that.
Yeah. So, basically like there's so many things with the healthcare system that you learn along the way and you don't necessarily learn going in. But like the biggest is like, one, does somebody even have coverage for PT? Are they in network with you? Like that's the first thing. Two, what insurance do they have? And what's that reimbursement level going to be? So like certain insurances, like they'll only pay for $70 worth of PT or $40 worth of PT, depending on what it is. So then like your supervisors and bosses are trying to keep the lights on, so they're looking at it like, okay, well, you can only see this person for x amount of time, or you have to see multiple people within that time frame to like get enough money in to justify like us paying you. So like that's an issue. First off is like, what are they going to pay? Then you're billing in these time-based codes essentially, so you're billing every 15 minutes, and then there's all these rounding up things that occur where it's like, okay, if they did 8 minutes of this, you can round that up to 15 minutes, and there's all these headaches with that come into play. And then you're often limited to whatever the diagnosis is and what you've been approved for. So if you come in with a shoulder injury, but you're like, hey, I tweaked my knee yesterday playing soccer, can you look at that? Oftentimes the answer is technically no, I can't, or the insurance company won't pay for me to do that. I obviously, want to do what's best for the person in front of me, so I would, but then you have to like document it in a way to justify it, and there's just a lot of loops or hoops and things you got to jump through, and it just makes it really difficult. And then depending on how many people you're seeing, you end up doing a lot of notes to justify that payment, and then you start documenting. And if you're doing a good job and you're not doing your notes while you're seeing your 10 to 15 patients a day, then you're doing all your notes at the end of the day, and it just like it can turn into a headache. And you can still do a really good job in insurance based settings, um, but yeah. And then what you touched on there, I've seen ACL rehab patients who clearly need this 9 to 12 month rehab, where they should be coming in at least once a week, more like twice a week, get approved for 10 PT visits. And it's like, all right, well, now what do we do? How am I going to try to get you better in 10 visits, and who do I have to collaborate with and talk to? And I've seen some real horror stories when people just don't have the coverage. So, um, it's one of those things where if you do need PT, or you do have something going on, sometimes you have to be prepared to pay for it out of pocket, which I know is really um, hard for people who pay a lot for their insurance. Like I have a wife and a daughter and myself, and we pay over $1,000 a month just to have super basic insurance. Um, but yeah, we don't really get very good benefits from that. And so like if something happens, like we might have to pay for it out of pocket, and it's a little bit of a broken system, unfortunately. And I don't know I don't know if I'm the guy to solve it, but I just try to have fair prices and provide high value for like direct one-on-one care the best I can.
I gotcha. Yeah, yeah, it is kind of a broken system, and I'm figuring that. And I kind of had an inkling going in, and that's kind of where I've been looking lately. Because being I'm a little bit older as I got into this career, which kind of helps a little bit. And so I'm already thinking about what do I want to do outside when I'm graduating. And one thing I've noticed there's like a gap with patients that they go into therapy, they get the therapy, whether it's a total knee surgery or like you said ACL, but it's like where can they go after? To continue so they don't have either a relapse or, I think that would be my biggest thing if they don't relapse and they can keep going. Like, what's a good solution for them or what would you recommend people? It's like, hey, your insurance is limited, so I did this. What would be their next step?
Yeah, so I think that's where the role of like really good coaches, personal trainers, gyms, like educating your client on the importance of staying fit. And like, I think a lot of times the best kind of rehab and medicine for those people is just consistent movement, consistent exercise. So, like, if you are someone who ends up in an insurance based setting, you know, finding local trainers, coaches, fitness professionals who you can refer to, who you trust, a good friend of mine, Katie Dabrowski, she has a clinic and she goes out and, does seminars to local trainers called, fitness is healthcare. And basically, like, the amount of time that somebody often spends with their trainer or coach or whoever they work with from a fitness standpoint, it's often a significantly larger amount of time than they spend with their healthcare provider. So making that as collaborative as possible and having somebody to hand off to who you trust um, is really important if you are in that insurance-based setting and you are going to be limited.
So, do you think it'd be kind of beneficial and you'd probably recommend PTs like to start maybe finding those like coaches or personal trainers to try to work with to bridge that gap and maybe help? You think that would be beneficial?
100%. Like, let's take that example again of that athlete. And 10 visits is very few, but say you have an athlete who's only approved for 25 visits of PT post ACL. So you're only going to be able to see that person once every 2 weeks over the course of a year, more or less, and they probably need a year's worth of rehab. You need to find someone local, or maybe not local, maybe online, but preferably local, who can work with that client and that patient in between your visits with them. So if they do have a sport coach or a strength and conditioning coach that they can work with, maybe somebody at their school's athletic trainer, um, getting to know that person, collaborating with that person, using them to help administer your plan for the patient, is going to be really important. So you as the PT almost need to be like the guide at that point. Like, your treatment sessions aren't going to be where you get the work done, because one visit every 2 weeks isn't going to be what fixes the person. You in that visit need to be the guide, give them the plan, and then have them go execute the plan. And often having someone to refer to is going to be really important in that scenario. And it's just education for for the patient and the other person they're working with.
I got you. And I like how you mentioned like patient education, which is like a big thing, our especially my program is pushing. But I want to kind of take a step back and you mentioned how movement is really beneficial and good. Could you really kind of expand and maybe elaborate on like pain management and movement and how those kind of correlate? Because I don't think people understand how vital movement is. I mean, every day, like what it does.
Yeah, so I think sometimes you'll see this with patients who come in, or just like the general person you talk with, who they often are like, "Oh, I'm in pain. What did I do to cause that pain?" And they're almost always looking at the activities they chose. So they're like, did I move something? Did I bend wrong? Did I lift wrong? Like, they're trying to find the thing they did, when I feel like most of the time it's what they didn't do. So like, you'll look at this person, this avatar of somebody who, like, they take about 5,000 steps a day. They maybe go to the gym once a week. They don't really eat that well. They don't do much activity. And then they go and, say they go play tennis or something, and they strain their back. Their back hurts afterwards. they're going to blame the tennis, but really it's the fact that they probably didn't do much activity in like the other 6 days of the week besides the tennis. So movement ends up being almost this use it or lose it type thing where you need to like stay on top of it. You need to try to move your joints through their full range of motion as often as you possibly can. And there's probably a base level of activity we should all be hitting. I try to tell my clients like 7,500 steps is the bare minimum, like anything less than that, and you're basically sedentary. And then just, trying to build the habits of consistent movement as well. I had a patient recently, for example, she's a super high level power lifter. She has a very demanding job. She's working in aerospace engineering, and we've been working together for a really long time. And then we realized she was taking about 4,000 steps a day because outside of the time that she was training really hard in the gym for 2 hours, she was just sitting at the computer 18 hours a day. And it was like, oh, we've tried all these things for your back. Maybe let's just start walking for 30 minutes a day. And that cleared up so much. So sometimes it's just these easy solutions to chronic pains, aches, stuff like that, that we need to look at the easy solution rather than like, oh, let's advance this technique or let's rest more or do this intervention. Like we just might need to move more, get blood flow, work on tissue quality, tissue health. And there's a lot of downstream effects from exercise that work so well.
Could you really expand on some of those downstream effects that exercise really does? Because I know a lot of people, they just like have pain and they're like, oh, I'm going to take ibuprofen. I'm going to take this. I'm going to go to the doctor and do this. What advice would you give a patient if they came to you and they're like, oh, I have 4 out of 10, 5 out of 10? What's kind of your go-to and then your education you give that patient?
Yeah. So, if it's someone who's just like, they kind of have that low level pain. One, I want them to keep doing whatever they're doing as much as possible. So we don't want to stop doing activities. We just want to modify however we can. So my rule for everyone is, if you show up for whatever you're about to do, if it's say a bike ride, and you show up at a 4 out of 10, and let's say it's knee pain, and you feel your knee as you're going, and it's still just at a 4 out of 10 and it's there, kind of keep going through that. If it's escalating up to a 5, 6, 7, yeah, maybe pull back and let's not cycle as much, but let's figure out what else you can do. So I'm always trying to keep people moving as much as they can. Um, Trying to, educate them on, is there truly damage, or you just is pain an experience you're having? Pain is so subjective, and there's so much research about, it not being correlated to actual tissue damage or structural damage, that maybe it's just movement and getting your heart rate up, which will, dilate your blood vessels and get blood flow to the tissues that'll make them feel better. So there's just like, there's so many good things from, heart rate, blood pressure, stress management, literally just breathing more, getting more movement through the spine and rib cage and all those tissues, that like harder exercise or just movement will do, that you can kind of stack those big rocks and make somebody feel better without getting down into the details of like, oh, this is out of alignment or this is, actually damaged. So yeah, that's just, really quick elevator pitch for just like, yeah, you're going to feel better by moving more, getting your heart rate up. And like, let's try to keep doing everything you want to be doing, um, rather than resting and then, doing 8 weeks of PT and then getting back to the activity you want to do. Like, let's do it the whole time and then just modify accordingly.
I got you. And would you say that's more of a like conservative approach towards like healthcare instead of like going to your doctor, maybe try to do more of the movement and keep those daily activities and then stuff like that? Or what are some misconceptions maybe you see a lot of patients come in with?
Yeah, I think patients are very educated at this point. Like, everyone has access to Google. Everyone has access to, I shouldn't say everyone has access to healthcare, but most people have like, some experience going to healthcare professionals, getting diagnoses, and particularly if it's something chronic, they have a fair amount of education on what's going on. So you, as the provider, often have to like try to figure out how you are going to get your messaging to fit with who else they've seen, what other doctors they've seen. I think too many times we as PTs will pit ourselves as like the anti-doctor or the anti-surgeon. Like we see surgery or the patient going back to the doctor and getting an MRI as like we failed. But we have to realize like sometimes utilizing those services and figuring out where they fit into the patient's journey, your job is just to get the patient back to doing what they want to do. So, if the patient really wants surgery or they really want a diagnosis, you might have to work with them on that. So it's not like you don't win by getting them to avoid surgery. You win by getting them doing what they want to do at a high level, pain free, basically. So I don't really think of it as like conventional or conservative or whatever. It's like you just have to figure out what are the patient's goals, what's their timeline, and you'd have to try to fit into that however you can. So as I've gone through my career, like yeah, I used to be that guy. I was like, our goal is to avoid surgery, but our goal is actually to get you better, and however we need to do that, like we might have to lean on other modalities essentially.
So you say it would be like patient over diagnosis is probably a really good thing to think of when you're going into a situation with a patient.
Yeah, I think it's mostly just what you might think of as patient centered care. Like the patient has a goal, your job is to help them uh, meet whatever that goal is. And maybe that goal needs shaping. Maybe that goal is just like, hey, I want to be pain free. Well, okay, that's, a pain free existence isn't very likely. So we might need to frame that as like, okay, what are the activities you want to be able to do pain free? Like, what are things you haven't done because of the pain? Like, we might have to guide them on that. But yeah, I mean, and honestly, like, getting a diagnosis can be helpful. Some patients need that diagnosis. They need to know what's wrong, quote unquote. And that's going to help them, know when they can push and when they can pull back. So it's really just what I would think of as patient centered care.
So what do you think gives physical therapists kind of a unique perspective when it comes into like movement and pain and patient care?
Um, you mean related to like other healthcare professionals?
Yeah, just because like it seems to me that we don't have a lot of awareness. And I was listening to a video we had to one of our classes, and they were talking about how physical therapy has kind of become a verb, and like so the thing they're trying to do is really get us seen as movement science experts or movement experts. And I think that's something I'd really love to highlight and make awareness to for society to understand because we're talking about pain management through exercise. We know the benefits of exercise, you can find that anywhere. But what I think is really interesting is the unique perspective we as our profession can take towards that and towards patient care. And I just kind of wanted to see your personal opinion on that and maybe what you would like to say on that aspect.
Yeah, I would say that like one thing that we as PTs I think is really good about our education is the broad spectrum we get. So, we are PTs are in so many places. Like what I was ignorant to when I went to school, like I just thought of the PT as the guy in khakis and a polo treating the athletes and the runners down the street, at the PT clinic. And but we're in schools working in pediatrics, we're in nursing homes, spinal cord patients, stroke patients, cardiovascular, like all the specialties and the subsets of PT that we get educated on in school. I do think gives us this really unique ability to kind of look at the big picture and figure out where on somebody's health journey we can kind of jump in and make the most impact. So for me, like I enjoyed doing the rehab aspect of things where I was working with people who were post stroke and um, for lack of a better term, people who were just generally on the sick end of the health spectrum. But I saw that and went, okay, I want to intervene earlier. I want to prevent people from getting there in some fashion. So how can I work with someone who has back pain, but also just improve their general lifestyle? So maybe we can get other health markers. So like being able to see people in the varying stages of aging and that health spectrum, I think gives us a better perspective. Whereas, I think I'm not anti chiropractic by any means. Like there are good chiros, there are bad chiros, there's good PTs, bad PTs. But that is one thing with chiropractors. Like they're kind of limited in that they don't see people in all these different settings. They really see people in outpatient settings only. So sometimes when you're seeing people give recommendations, it's like, all right, well, that really only works for a small subset of the population, or you are forgetting this whole section of the population that exists. And I just think as PTs, we do get that really broad knowledge and then we get to focus in, but we never really lose that foundation of like, oh, yeah, I do remember this person who was in the nursing home and was dealing with this and so on and so forth. So I think we're just really good in that we can work with that whole spectrum essentially.
I got you. And it sounds like you're taking more of a proactive approach, I would say. So you're trying to maybe delay something happening through, like, using using our education, basically.
Yeah. Yeah. Essentially, I want everyone who comes to see me to potentially leave better. So like my goal for them is obviously to help them meet their goals, but I want them to hopefully go forth doing more or feeling empowered to do more than when they came in. So, I've had lots of patients who by visit 4 or 5, like technically the reason they came in is gone, but in visits 6, 7, 8, 9, we're going to start to set them up with an exercise plan moving forward. Or, oh, there's this thing they've always wanted to get back to, like they haven't played basketball since they were 20, but let's start to work on plyometrics and jumping so you can get back to feeling young and improving like quality of life rather than just like, hey, let's avoid pain and prolong lifespan.
I gotcha. Yeah, I kind of like that, like proactive. I guess that'd probably be a better way to say it's like a proactive, so people can maybe delay the onset of either having to get a total knee or have an ACL rupture, things like that. Do you see maybe a gap when it comes to high school sports and things like that? Because I feel like, especially just in my area, there's not a lot of strength and conditioning professionals around. Like you have personal training, and I do believe personal training is getting better from what I've seen. But what are some gaps you've noticed?
Yeah, so I think there's general gaps. So like at the high school level, there's a lot of things that can be worked on. I think the biggest thing right now is sports specialization happening too early. So like when I work with high school athletes, most of them are single sport athletes by the time they get to high school. So they're 14 and they're just down to one sport. And I think that's a huge issue. I think from a um, growth standpoint, development standpoint, like having different demands is really important. So the football player should also be playing basketball. The volleyball player, she should also be, maybe running track or playing soccer or doing something where she has to move in different planes. So, um, and also just having an off season, I think is the biggest thing. So like kids are just going year round in one sport right now. So whether that off season be some sort of smart strength and conditioning or other sports, I think that's like the biggest gap that's happening at the high school level. If we're talking as people get older, I think the biggest thing missing right now is that when you turn 18, basically when you stop playing sports, you stop training like an athlete. And I just think there's so much about athleticism that should carry through the lifespan. Like we should be able to sprint and run and throw and jump and do all these things as long as possible. Because when you see people who are aging well, they can do those things. So it sort of turns into that use it or lose it. I think a lot of fitness as people are getting older gears towards burning calories and just building muscle, and they no longer do the like athletic fun stuff that I think helps keep you young and often will help you hit whatever those physique or health goals are or weight loss goals at the same time. So, from the high school perspective, I think it's just like that more education around more movement is better and more diverse movement and not specializing. And then as we get older, I think it's literally just trying to hang on to your athleticism as long as you possibly can and keep developing it. Like research shows that we can keep developing athleticism until 28, or beyond, depending on gender and sport. But but for some reason we just stop at 18 and switch to doing, bodybuilding and Orange Theory.
Could you explain why it's important for those kids to kind of play multiple sports versus just specialize? And then kind of expand on why people should start, I would say, working out as in like an athletic capacity versus the bodybuilding as they get through the aging process, like why it's important they do that.
Yeah. For the sporting aspect, I think the biggest thing is just like tissue development. Like you have these kids who they are still growing. They might not have the, just like the tissue quality in their ligaments and tendons to handle the demands of the amount of games they have to play. So take like a baseball player or a soccer player who's playing a tournament every single weekend, 5 games in a weekend. Like that's such a demand on the body to recover from, and your body's going to start to adapt to that demand, but you might be taking qualities away from just like general movement and life where you're supposed to be able to do certain things. So you might start to, I mean, you're seeing kids get Tommy John surgery for their elbow like so early now because they're throwing too much and they're just not recovering. And they have these super demanding schedules where they have to play tournaments every weekend. And they're not getting the recovery. They're not developing like full capacity. I think you're also seeing like an underdevelopment of just like general physical preparedness, like certain energy systems, aerobic capacity, things like that, because kids are, they're not running around and like doing that GPP stuff as much. They're just like, oh, I go to my hitting coach, I go to my pitching coach, I go playing games, and they're just kind of missing out on some of that. Like, it's very skill based, whereas I think if some kid is playing different sports, they're going to get so many different demands essentially on like what they have going on. Um, anything more you want me to say on that before I kind of go to the adult part?
So like getting that demands in it, is it helpful to really change up your movement patterns? Would that be kind of essentially a theory behind it? I would say.
Yeah, I think that's a theory, like just getting exposure to different movement patterns, but also just like different plane, like moving in different planes of motion. There's going to be certain things around, like if you are a one-sided throwing athlete, you're always going to be turning one direction. Whereas if you play baseball and soccer, you're going to have to rotate both directions. So like, yes, I think movement variability is like the biggest thing there, and just not overdoing the same pattern over and over and over again.
So one more thing, do you have like advice or specific things you tell parents of kids that might only be very sport specific to kind of give them an idea, like, hey,
Yeah, I mean, essentially just that. I try to get them to chill out. It's hard. Did you play any sports growing up?
yeah, I ran cross country and swam, played track, so.
Gotcha. Um, did you do any of them, like for swimming, for example? Like, how long of a period did you swim?
Honestly, I just did my senior year because at the time I was prepping for the military, so I was kind of doing that, and it was off season between track. So,
Gotcha. So swimming is like one of the best examples of, you see these kids who when they're like 8, 9, 10, they start setting like, they're winning everything. They're setting records. Like parents get super gung ho, like, cool, my kid's going to be a collegiate swimmer, a pro swimmer. And so they just start making them swim, just like they swim year round now. And pretty much all those kids you see who do really well when they're young, they never turn into anything. They never make it into anything. Like maybe some do, but maybe some like go to college or last to college, but most don't make it that far. So I think, one, I try to educate parents on like early success doesn't mean anything. It's not a harbinger of things to come. Like kids are growing at different ages. Like you just want to be as well rounded as possible. I find that like storytelling and giving examples is always the best way to get those things across. So I'll talk about, um, as terrible of a person as he is, Urban Meyer was a pretty good football coach, and he was like, we only want to recruit kids who play two sports. We don't want to recruit kids who only play football because they're going to be burnt out by the time they get to their freshman year and they're going to be overdeveloped for football. We want raw athleticism that we can continue to develop. So, relaying those stories, or relaying the kids that I played with, who I played pretty high level soccer, relaying to those kids, who the kids I knew who went on to play at the higher levels, and their backgrounds and how they played multiple sports. Like just trying to bring all that into parents if that's the goal. And then also just talking about, some of the cases I've seen where I've seen the kid. I mean, I've seen a 12-year-old with an ACL tear, which was unheard of 10, 15 years ago because she played soccer year round. So it just depends. Like, you might have to get positive, you might have to get negative, you might have to scare them a little bit. Like, there's certain things. I like to think it's going to get better as my generation turns into parents of older kids. So I'm 33, I'll be 34 this year. I have a 2-year-old, she'll be what, 14 in 12 years. I'll be in my mid 40s. Like, I'm hoping that my generation does better, because mine was the one who, when we were coming up, like, just because you were good at a sport or you were on a good team, everyone was like, "Oh, you're going to play in college, you're going to get a scholarship." And then we just dedicated ourselves to it, and parents were overzealous. And I think there'll be more people who experience that at my age. And now with like the internet and recruiting being more national and stuff, like, I think hopefully people will be a little more like down to earth and chill about it. But I also might just be wildly optimistic, because you still hear of terrible sports parents all the time. But we'll see.
Yeah, and I think what's really interesting is because a few of us in my PT class are going to get our strength and conditioning certification. And so I really feel
Mhm.
like if we can get more to do that, that might help too, especially with conversations and education, and maybe closing that gap. And like you said, the parents too. But
Well, yeah, and I think as a PT, you should really be able to speak across the spectrum of training and rehab. Like, to me, if you came and saw my clinic and how I work with people, I don't think you would be able to tell who's the fitness client and who's the rehab client. Like, they're all doing different things just along a spectrum, essentially. And I think that most there's obviously some cases that are unique, but most people can kind of fit into that spectrum somewhere. And I do think school kind of underprepares us for that. And you do hear the stories of somebody, or the PT clinic that doesn't have heavier than a 5 pound dumbbell or something like that. And it's like, all right, well, you're not you're not servicing that client the way they should, because load matters. You have to progress them. So that's one thing I spend a lot of time like mentoring young PTs on, is like, hey, we need to be able to go across this spectrum, and you need to be able to write exercises in the right order and how to progress load and stuff like that. So yeah, I think, you know, whether or not that's part of the actual DPT program we need to bring in, or it's like you and your classmates are doing that on the side and educating yourself, like, that's a super important part of being able to do well by the people in front of you.
yeah, I would say it's mostly us doing it on our own just because we have the interest in it. And like not knocking
Yeah.
DPT programs in general. Like we had a health promotions class, which was really beneficial. But I mean, it's not the same as a deep dive into that strength and conditioning book. So, but you were talking about
Yeah.
load, and I think
Yeah.
that's a. Oh, sorry. Go ahead.
Oh, no, no. I was just going to say, I agree with you. Like, school has to teach us so much that there might not be room for it. I just think if your plan is to go into some sort of outpatient orthopedic sports realm, you have to be able to talk that full spectrum, essentially.
Yeah, I agree with you. And I appreciate that. And I think that's really good advice for PTs out there, especially myself as well. They're trying to do that. And then you mentioned kind of like progressive overload or like loading the body. And I think that's a good segue into why you were talking about how, as you get into the aging process, why you need to continue to train like you did when you were younger and athletes, whether you're an athlete or not.
Yeah, I think within rehab or in general, like you said, that concept of progressive overload, most people just don't understand. So, for the person listening who doesn't know that, it's simply just say we're going to talk bicep curls. That's always the easiest one. Um, or like squats. If you go in and do 3 sets of 10 with 10 pounds, the next workout you want to go in and you need to change one of those variables. So you're either going to add a fourth set, you're going to add one rep, or you're going to add some weight, essentially. You don't want to go in and just do 3 sets of 10 over and over again. And I think the average person who does some sort of weight training or fitness, that's what they do. They go in and they do the exact same thing at the exact same weights over and over again. And what you're lacking there is you're lacking that stress to the body that the body has to adapt to. And I think that within rehab in particular, if you go to a normal clinic, it's a huge issue. You go in, you watch the person do 20 reps of every exercise with the yellow bands, and then maybe they go to the green bands or what's next? Red. I don't have TheraBands in my
Right,
clinic.
yeah.
You can tell. But like they go to red then, and there's just no overload. They're never adding volume. They're never challenging someone with a tempo or something like that. And you're just not getting stimulated enough for your body to adapt. And when you talk about the aging process, I think one of the biggest things is that we start to lose our type 2 muscle fibers faster than we lose our type 1. And what that means is we lose our power more than we lose our endurance. So when you go and you see that old person who has a really hard time standing up from the chair, like a sit to stand is like a max effort exercise for them. But then once they're up, they can walk for a really long period of time. That's that loss of type 2 muscle fibers. And really, the only way that we know in the research to combat that is to train them. So you have to do some sort of power based activity that has enough load to be stimulating to those. And it has to be in that, less than 10 rep range. And it has to be done somewhat dynamically. And you have to know that as a provider or a fitness professional, because otherwise, if you're just making somebody do movements for the sake of doing movements, you could pick the best exercises in the world. But if you don't know how to dose and load them, you're not going to get the results that you want or your client essentially needs.
I gotcha. Um, so going back, because you see a lot of people that get into like the bodybuilding kind of mindset and mentality. For those, because we're talking about the aging process, do you have like some simple ways people can understand like the difference between like what the actual bodybuilding like exercises they're doing versus like the power, the type 2 fibers? Could you kind of break that down in like a simple way? So someone might be like, oh, okay, now I understand. I need to add this in too.
Yeah, so I just think anything where you're doing a good way to think about it is like, and there's nothing wrong with bodybuilding. I just think it's that if you only
Right.
do the bodybuilding, if you only do the bodybuilding style, you're probably not going to be very fast and explosive. So I think a few things to think of there are, one, can you do things in different like planes of motion? Are you bending, twisting? So certain things like throwing a med ball will be really good, but you also then want to do thing or sprinting or jumping, like jumping and turning in the air onto a box. Like certain things like that are going to be of a slightly different demand than just like doing a bicep curl or doing a leg extension. Excuse me. What kind of separates the two from what you're saying is I think it's the rep range and the intent behind them. So you might see somebody do something like let's say a jump squat, for example. So they're squatting down, jumping up as high as they can. If you do that for a set of 20, you're going to be not jumping as high as you can every time because you're going to be getting fatigued. Whereas if you do that for 2 max effort, that's going to stimulate more of that power and speed response. And you're going to jump higher and your body's going to adapt to that different than if you just did 20 in a row. So I think doing certain things that are like truly close to a max effort and doing them for fewer reps is what's missing in a lot of people's training. And that doesn't have to be lifting super heavy for a 1 rep max, but it can be throwing a ball as hard as you can or sprinting 10 yards as hard as you can. Like certain things like that are what we don't do anymore when we stop playing sports.
Gotcha. Could you also kind of speak on how like that works with your connective tissue versus just like your muscle strength? So I think that's the misconception people don't understand, or that maybe they don't hear. I mean, you can find it, but still, I don't think people understand it.
Yeah, so I think it depends on the person you're working with. Like certain athletes, and I just consider most people to be athletes, so kind of people in general, they'll be somewhat more like what we would call tendon driven athletes, and they're going to be like bouncier. They're going to be the person who's really skinny but can jump really high. That person who was just like naturally fast, naturally good at jumping. And then you're going to see more like power based athletes where somebody responds really well to getting strong and kind of building up like their muscle belly and power. And you're going to see that person respond really well to heavier weight training, you know, in the beginning, but then we might have to bring back in some of those more like bouncy activities that they're not as good at. Whereas the really bouncy athlete, like by doing more just like general weight training with them, we might be able to give them more of what they're not good at. So you're talking about trying to like improve what they're good at by also, but also bringing up what they're bad at essentially. And I think within that context, like you just want to be able to look at people And most people you look at and be like, cool, you're just out of shape. So it doesn't really matter what I do. But you want to get good at both strengthening the tendons, which that can be things like plyometrics, that can be things like isometrics. And then you also want to drive blood flow to the muscles and work on the muscle belly. That's going to be things that are more done at controlled tempos through full ranges of motion. So just kind of having that mix. And whenever I write a program for someone, I'm always trying to touch on everything, but then give the individual what they need specifically just a little bit more of.
I gotcha. And so I kind of like you where you said you consider everybody an athlete. I think that's a really good idea and way to come of it. And I agree with you on that. And I think people will probably be like, oh, athlete, and they think these superstars, but in reality, like all of this is good for people, especially overall health. And the research shows kind of it can, I wouldn't say delays the aging process, but it's gonna make you, I would say, lengthen the amount of independence you have as you age. I think that's a good way to say it.
Yeah, 100%. I mean, it's kind of like it's one of those things where it's like the longer that you can probably run really fast, jump really high, throw something really far, get up and off, get down like into a burpee and jump back up like off the floor, on the floor, off the floor, all that stuff. Like probably you're going to live a higher quality of life for a longer period of time. And yeah, so I don't know if it's like quote unquote delaying it, like you said, though there is some research that like, in terms of holding on the muscle mass, that might be the case. But yeah, I think you just are able to do a lot more for longer.
Yeah, I agree with you on that. Um, so kind of going off topic for a second, I kind of got to ask you, what do you have like a really unique patient story you could tell us that kind of really solidified your decision or kind of re-ingrained why you chose physical therapy? I know you said it was like kind of by accident, but now that you're in it, has it really solidified that you made a great decision?
Yeah, you want the great decision one, or you want the somewhat the one I learned the most from.
Let's do both. Storytelling's awesome. I like to hear it.
Deal. So yeah, basically the great decision one. I had I had a whole family I treated at one clinic, and I saw all four family members at some point in time. This was not when I was on my own yet, and sorry, just within different periods of time. But they had two high school daughters. One, she was just she was a super nice kid, a little bit on like the bookworm side, liked playing volleyball, wasn't as athletic as her sister was, and she decided like hey, I'm going to go out for track and I'm going to start throwing, and she threw and basically did fine. Wasn't amazing at it, and we had worked together to work on some back pain, and then she said she wanted to start like lifting weights and everything, and her parents decided like they were cool with her training with me outside of the clinic. And basically at the time I just had a garage gym set up, and she and her mom would come down, um, I think twice a week basically, and they would come down twice a week, we would lift weights, and she just like she, one, never really got injured again. Two, just took to weightlifting. Absolutely loved it. She was like, probably I think weighed in like the 165 range, something like that. And after like a year, she was able to trap our deadlift 405. It was pretty incredible. And that next season, she finished second in states in the discus. She added 40 feet to her discus, and she just still lifts weights to this day. We still communicate. This was over 8 years ago now, and she was just like, look, this totally changed my life, my relationship with how I thought of lifting and training, and my body and pain and all this stuff. And like just that impact that you can have on somebody like that solidifies that to be like an amazing decision from my aspect. And fortunately for me, she's one of like many that I've had that story with, but she's one who stands out the most because I also bring her up all the time when I work with high school boys who are really stoked about deadlifting 315. And I'm like, cool, I've seen an 18-year-old girl deadlift 440, so you guys should probably stop hyping each other up so much.
Oh, that's awesome. I really think that's what's amazing about our profession. I've seen the patient connections we can really make as therapists. I really enjoy that aspect.
Yeah, I mean, you often get to spend way more time than they ever do with their physician or their surgeon or whoever else. So you have a lot of time to get to know them. And, if you do really try to do that patient centered care, you can make a huge impact. If you try to coast through and, just get your notes done, that might not do as well for that person.
I gotcha. So is there anything you like feel like society should know, or maybe some PT students should know, or any advice you'd have for anybody?
Yeah. So, basically the other story that I had was, I just had a patient. He was 20. He was my age at the time, so he was 27, 28, and he had knee pain. He had a mechanism injury. He um, twisted his knee jumping in a concert. We worked together for about 4 or 5 weeks. Wasn't getting any better. Wasn't really doing his exercises. Um, so I was kind of harping on him to like do what he was told, and he wasn't really doing it. And I thought he was being a little bit of a baby about the pain. And we were going through everything, and we talked. And at that point in time, I was deep in the research on like, we're over imaging. We're doing way too many MRIs, stuff like that. I was like, you just need to kind of push through. We need to do this. Probably 2 more weeks went by, and like pain wasn't getting better. And I was like, look, man, you got to get an MRI. And I was doing it at that point to be like, look, nothing's wrong. You're fine. Let's push through this. And it came back that he had osteosarcoma of his tibia, and he had this tumor that was there. And he was super thankful to me. He was like, hey, we caught it really early. That's great. Thank you. And I kind of was like, oh crap. Like that is not at all what I expected was going on. And, we kept in touch for a really long time. He did end up passing away from that about a year later. So we really didn't catch it soon enough. And, that to me just kind of leaned on this idea where I was like, look, I have a 3-visit rule now. If you're not any better in 3 visits or you've gone backwards, we're getting imaging. And to me, that's just like something important to keep in mind is, one, listen to everything your patient's telling you. Like, no matter what, try not to make too many judgments right off the bat. And, two, again, each patient, you're trying to do as much patient centered care as you possibly can. So whatever you can do to really communicate the importance of what they're doing, getting good feedback, good monitoring systems for their pain and movement, like just really trying to do the best you possibly can for each patient. And, you're not going to be everyone's savior, but having those kind of good rules and heuristics in mind of like, hey, if they're not better, we're going to get imaging, having other providers to lean on, all that's really important. So I think just, remembering that the patient is the most important part. You're not the hero in the patient's story. Like, you're just a bit player there, and you just trying to do what's best for them to figure out. That is kind of that what I take from that, and what I think most people should try to realize as they are working with people one on one.
I appreciate you sharing that story. Yeah, I would say personal bias is probably a big one in our industry, or at least something I'm noticing. Because I know in our classes we've hit that, like, oh, imaging, it's not the greatest, this or that. Back surgery is not the greatest, this or that. It's like, well, it has its purpose and its place.
Yeah, 100%. And I think it's really good to be able to speak on those things. Like, you get that person with back pain, and it's great to be able to tell them like, hey, so much of the population has disc herniations. That doesn't mean anything for you. But again, if they're having these terrible radicular symptoms and they can't lift their foot and all this, like, hey, this might actually be a case where that disc herniation is affecting you and you do need surgery. And just like, again, realizing that's not your failure as a provider. They're often going to be thankful that you pointed them in the right direction to get better faster.
I got you. Yeah, well, that's awesome, man. So where would you want to see the profession go, kind of from your personal perspective and opinion?
Oh man, that's a great question. Um, I do think more focus on collaboration and more focus on like the general fitness aspect of things is going to be big. And I know schools are trying to work on the collaboration aspect, but I do think just kind of identifying where we can make the most impact for people, I think is in promoting fitness and health. And I think we've lost some of that to trainers. Like, there are a lot of good coaches and trainers that are taking over that space and starting to almost treat injuries a little bit. And we're so focused on, trying to safeguard things like, uh, you know, being called doctors and the ability to dry needle and, all these legal fights we get in and the APTA doing that stuff where I think we just need more education about how we can impact people on the biggest level, which is just improving fitness. And then, yes, we can treat their injuries at the same time. But, um, I think having a way to know that, do that again, is that referring out to providers you trust or is that doing it yourself? I think that's one of the biggest things, and not just trying to make somebody's pain disappear in one session and, whatever other gimmicky things that we hope we can do.
So it sounds like that you're really kind of an advocate for like patient education and like health promotion towards the population.
Yeah. And then that health promotion being keeping your fitness, keeping your athleticism, trying to improve that as much as you can and maintain that as much as you can. And, um, again, being as a provider, being able to speak across the whole spectrum of training and rehab.
Well, yeah, Kevin, I appreciate your time and effort. And I got one more question for you. So, kind of going off the question I just asked, is there a legacy that you want to leave behind when it's your time to kind of hand over the torch to the next generation or the next, classes of PTs?
Yeah. I think it's important. This is a little philosophical, but I think it's important that you have to realize probably within 50 to 100 years of you being gone, no one's really going to remember you except your family, and I think it's important that you leave a really positive impression on the people you interact with. And that to me is, how did you make them feel, not what did you do for them. So, I'm sure a lot of my past patients don't remember what exercises I gave them, but they do remember, or hopefully remember, that they enjoyed coming to the clinic and I listened and paid attention to them and respected them. And, I hope my legacy is that people know that I cared for them or I treated them like equals, or, tried to help them out the best I can. And whether that's working with the high school athletes I work with or my patients, like I just want people to, um, have felt comfortable and good and, remembered me for, just being a positive light on them and their experience.
Yeah, it sounds like you are. I've seen some of your stuff on Instagram. I like it, especially like
Thanks,
your
man.
educational stuff. I appreciate it. So appreciate what you're doing. I appreciate your time today talking to me. It really means a lot. So
Yeah, of
I'll
course.